Around 54% of all American adults drink coffee according to USA Today. Why is that? Are there health benefits? Or is it just a taste and energy boost that it supposedly gives you? Did you know that coffee is actually good to your mental health? Here's why coffee is good for your mental health. For one, it helps with depression. According to a study done by Alberto Ascirio, professor of epidemiology and nutrition at Harvard College, of 5,039 United States registered female nurses over the span of 10 years, as the amount of coffee the women in the study drank, the lower their risk of developing depression became, to where women who were drinking a large amount of coffee only had a 23% chance of developing depression compared to the rest of the women in the study. In his study, Effects of Coffee and Caffeine on Mood and Mood Disorders, Miguel Casas, who is a doctor at the Department of Psychiatry and Forensic Medicine in Barcelona, states that although caffeine does not produce a defined effect on mood, positive findings of significant mood effects are more numerous than negative findings, and that habitual caffeine consumption can clearly improve mood and not worsen depressive disorders. Bernard Goodman, in his study, The Neurological Effects of Coffee Consumption, calls coffee a neurological stimulant and states that, although the effects that coffee gives to those that drink it depends on many different factors, that it still has a largely positive effect on mood and behavior, and therefore could reduce the risk of mood disorders such as depression. Not only that, he also states that there is a possibility that caffeine consumption can lead to the reduced risk of serious neurodegenerative diseases such as Parkinson's, Alzheimer's, and dementia. Drinking coffee is also good for your mental health because it reduces the risk of suicide in individuals. Ichiro Kawachi, MD and chair of the Department of Social and Behavioral Sciences at Harvard School of Public Health, conducted a study that examined the relationship between coffee consumption and the risk of suicide. In his 10-year follow-up study of 86,626 United States registered female nurses, Kawachi concluded that caffeine consumption and the risk of suicide have a strong inverse association, meaning that as caffeine consumption increases, the risk of suicide decreases. Arthur L. Klatsky, MD, Marianne Armstrong, and Gary D. Friedman in Coffee, Tea, and Mortality conducted a study on 128,924 people and the link between coffee and tea ingestion and mortality risks and rates. They found that coffee consumption can lead to a lower risk of death by liver cirrhosis, and that drinking both drinks also lowered the risk of death by suicide, and that the risk was even lower when it came to drinking coffee than it was with drinking tea. So you see, there are actual good reasons to drink coffee than just the taste or the energy boost that it gives you. It's good for your mental health and can even be considered a mood booster, making you feel better. So next time you're feeling down, grab a cup of coffee and relax. You can say that you're doing it for healthy reasons, despite what your parents say.